Hey everyone, I'm back. I think that was about 10 minutes rather than 5, but I was trying to get you the most up-to-date information about what's going on right now with the pandemic. So, the theme is pretty much the split personality of our nation. The split personality is more evident than I've ever seen it, actually. Uh, we wake up in the morning and we see just the most god awful news ever, and we think, oh wow, I thought maybe things were getting better, and then we're seeing, oh no, this just sounds like endless death and destruction, and then we go online on social media or whatever, and we see video or pictures of people at the beach, like Huntington Beach in Orange County, and we think people are insane, right? I know, I know. So how can I even talk about this? How can I show my face when, you know, in March or February, I thought this thing would be over rather quickly because I already knew about two therapies and how they had some great results, even if they weren't in double-blind controlled studies. And so I thought, well, of course, we're just going to figure this out and protect our elderly and protect the vulnerable, and then we can get right back to work. Well, I was wrong. So how can I show my face today? Well, I can show my face because, number one, I always keep calm and share complete facts, and I'm never afraid to admit that I'm wrong or why I'm wrong, partially wrong, perhaps. Number two, I am really shocked and disappointed that the therapies that I saw that continue to have promising results were so maligned in the media. I never thought that would happen. So now I'm just going to look for Orange County coronavirus deaths and cases. Orange County, has a very low death rate. So you see people on the beach and you're thinking, what idiot? What idiots? And then you think, oh, well, wait. Literally, Orange County only had, let's see, Orange County had 1.6 deaths per 100,000. That doesn't mean a whole lot, but I will try to find their total deaths. It's a little bit hard to find the county level. Okay, so yeah, okay, just give me the total. Orange County has had 50 deaths total. 50 total deaths. Los Angeles County has had 1,172 deaths. Riverside County has had 156 deaths. San Bernardino County has had 94 deaths. San Diego County has had 134 deaths. The whole state has had 5.5 people per 100,000 population. That's like a bad murder rate, just to give you a little perspective. And I don't know about San Francisco because it looks like this article is focusing on Southern California, but it's really amazing how Orange County has only had 50 deaths. Now, I'm not saying that a whole lot of people couldn't get it going forward. There's so many factors here. Let me see who has joined me so far. Oh, okay. Well, I am waiting for y'all. Oh, there's one person here. Hi. Let me know you're here. Say hello. Let's see. I still have a hard time with this. How does the microphone sound? Okay. So for Orange County, it's a mystery. For San Diego County, which is huge, it's a mystery. Obviously, poverty is a factor. And so we know that. We know poverty is a factor. Hi, Robert. I'm back. Thanks for joining. I was just saying that the theme of this video is the split personality of our country right now, which is just, it's at the highest level I've ever seen, where we go to bed at night, we think, okay, things are getting better, there are fewer deaths. Even New York City peaked on like April 9th, and many states have, quote, peaked in terms of daily deaths, but that still means that even though there are fewer deaths, there are still deaths. We have that. We have the fact that none of us have really paid much attention to infectious diseases up until this year, this crazy year. And so we're just waking up now and analyzing the data for ourselves, because I can tell you right now, the media is not analyzing complete facts, not by any stretch of the imagination, not by any measurement are they analyzing or transmitting to you complete facts. This is what people always try to get what my bias is, though, and they can't figure it out, because I'm not leaning toward anything. I'm not leaning toward, let's just say, screw it all, we're going to all go out from our houses. That's your decision, and you need to be informed about all of the different factors involved in infectious diseases based on all of the available research that we have. But my job today will be to go through all the conflicting messages, the mixed messages. Hi, Susan! Nice to see you. Thank you so much for commenting. Yeah, I've been digesting information over the last week. It's been really an intense time for me, hard to get away, and then also just digesting all this information. I'm used to getting a narrative and knowing that it's not the complete story, and then having to really center myself in order to find the complete story. But I have never, ever experienced that feeling as heavily as I have in the last 2 months. You really have to keep your center. It's quite an amazing thing. So that said, I want to talk about the main areas of conflicting messages or split personality. I would say schizophrenia, but the definition of schizophrenia is actually not split personality. It's just used that way in the layman's world. So the first thing that doesn't add up is we're talking about a big failure in New York City. New York City has more than 20,000 deaths so far. That is about 1/3 of all of the deaths in the United States. It is far above any other state or city. Far, far, far above. Even New Jersey, which is considered high per capita, has a total of 7,000 deaths. So then, why on earth? Hi, Sandra. Good to see you. Why on earth, then, did the USNS Comfort just leave the harbor in New York after treating 182 patients? Why did the Javits Center just close after treating 500 patients? Why are we seeing articles about a woman who was a lead doctor in the ICU at New York Presbyterian who took her own life, allegedly, at her sister's home in Virginia, in Charlottesville, actually? Why on earth are we hearing about caregivers' despair? Why on earth are we hearing about death in New York City continuing? And from what I've looked at, it seems preventable, and it's absolutely heart-wrenching and heartbreaking to watch this happen. My first thought was that, okay, so regarding the disconnect with the Javits Center and the USNS Comfort, the disconnect is that there are people waiting at the emergency rooms still. And apparently, from what we heard anyway, I heard an anecdote that the woman who killed herself had told her father that there were coronavirus patients waiting in ambulances for 3 hours outside her hospital. This sounds like a logistical problem. This sounds like there's not enough people funneling patients to where they need to go. Now, if that was the case, why hasn't that been corrected? Why did the USNS Comfort leave at the request of Governor Andrew Cuomo? He had requested the ship, and he also requested that it leave, that they didn't need it. Why on earth, then, are the people on the ground in Manhattan suffering so much? Why did they close the Javits Center? It does seem to be a logistical problem, and I appreciate any of your comments and feedback on this. So the logistical problem is quite disturbing. Of course, I looked for an article on that, and the only outfit that had an article on logistical problems in New York was Fox News. I get so many attacks by people who, honestly, most of my readers are perfectly fine reading Fox News, but I'll get the occasional person who thinks we're living in 1999 or 2003 still, and they think Fox News is the whole problem with with our country and the sharing of information or lack of. Well, I've got news for you. It's part of the same machine, but they have corrected a lot of the problems that they had during the Iraq War, where they just accepted the intelligence of the American government and Colin Powell, President Bush. I think everyone realized they were hoodwinked. So their jingoistic stance has been corrected for a long time. Now, are they conservative? Well, yes, the commentators are conservative on Fox News, of course, admittedly. But you still get valuable information. And like I've always said, and when people ask me, should I watch cable news? Yes, you should. You know why? Because it's live TV, and you get to see people in charge of different areas, and you get to see in real time admissions they might make, or even if their opinion or the things that they're saying are not complete facts, you can put that in your memory bank and really evaluate the situation based on what you see. So that is why I still value and watch all cable news, and I think that it has merit. So back to Fox News, they had an article about total failure of logistics in New York. So you can look that up if you want. I am going to keep going with talking about the things that I've found that don't make sense. Okay, so another thing that does not make sense is, why did Seattle, which had the first case of coronavirus from Wuhan, somebody actually flying in from Wuhan, why did Seattle do so well? Why is it that Seattle only has, I think, a few hundred deaths? I think 500. I'll have to double check that. So I'm going to look at Washington State rather. And there's an article in the Telegraph. The Telegraph out of England has done a pretty good job of covering the pandemic, I will say. Now, let's just see what the total deaths are here. In Washington State, okay, Washington State, total deaths are 810. And I don't have the city level, but obviously that's just a pittance compared with New York City's 22,000. And so the Telegraph had a pretty good article. I had to subscribe to read it, but they had a pretty good article about why Seattle did better. Basically, though, their main premise was that they started social distancing on March 4th, and requested that Microsoft, the biggest employer, tell their employees to work from home. Okay, so that's all well and good. And then, they said that the mayor of New York, Bill de Blasio, he was saying on TV that the risk was low, just like Anthony Fauci was saying the risk was low, all the way into March, and that New Yorkers should just go about their business So, it is possible that Seattle, having learned from the SARS outbreak in 2003, had some influence from Asia as far as being ready. But, the University of Washington is the one that has a lot of the models that they've revised their predictions way down, and so for some reason they were definitely ready. Now, contrast that with Atlanta and the CDC. That gets into a whole other thing, but the testing is such a big deal, and I'm working on a testing article right now. And what I found was the CDC has always been seen and has seen itself as the leader of the world in terms of infectious diseases, emerging infectious diseases, and pandemics. And they are a huge organization. They had a conference in Atlanta in 2018 specifically about infectious diseases. And to go through and read their abstracts or their program for the event was really, really disheartening, because they're talking about bringing a mentoring program to third world or emerging markets, emerging economies, developing countries, bringing a mentoring program as far as testing, when, oh, guess what? We were caught flat-footed, and absolutely unprepared for testing of any type of rapidly moving, emerging infectious disease. So to see that was truly the irony. And this CDC program was this glossy, slick, like 50-page program, and I just took a few snippets from it. Okay. There's a bunch of different topics, breakout sessions, expanding a transatlantic quality assurance laboratory mentor program. In July 2017, the Centers for Disease Control and Prevention and the Association of Public Health Laboratories, with collaboration from the WHO and an African health organization, held a kickoff meeting in Kigali, Rwanda, to establish a second iteration of the Influenza Laboratory Quality Assurance Mentoring Program. So, yada, yada, yada. Basically, we were outwardly focused, we being the CDC. And then what I did pinpoint, I'd like to talk about testing, because it really is maybe the most tragic thing of all is the testing. So I just want to say that I've been learning a lot. The pharyngeal nasal swab really is the only way still to detect active cases. And it requires a very expensive piece of lab equipment, which is why I can see that they were mentoring Rwanda in it. But they needed to be mentoring the states and the counties as well, and they were not doing that at all. The Association of Public Health Laboratories is also involved, and I wonder to myself why they didn't make sure that more laboratories around the country had one of those machines. So you take the pharyngeal swab and you place it in a machine like a centrifuge, and you replicate the virus. You replicate the virus and you compare it to the genome of the novel coronavirus, and that is the only way to detect an active case. Now, we've been talking about antigen tests a lot, blood tests. Well, I finally realized, even though I've been reading about it for weeks, that the antigen test does not detect active cases. I don't know if you all knew that. And the antigen test is useful. South Korea implemented it immediately, and so did Singapore. In fact, I think Singapore had the first antigen test. And the way that it's useful is that you can trace back. You can see who had it previously, because they have antibodies, right? Obviously. So you can trace back who had it and where. But if you don't have that sophisticated swab test, you are not going to be able to get ahead of it. So in the Singapore case, they actually traced it back to a church where some people from Wuhan had attended. But they did this, like, let's say it was maybe a week or two after those people had infected others. But if you don't have the antigen test immediately and very early, you can't even really trace the contacts. You understand? I mean, if you do, it's going to be, you know, thousands and thousands and thousands of people. But the pharyngeal swab test, which is, it's called a PCR test, it's the gold standard, and it's the only one that can detect active cases. That needed to be everywhere, every town, every city. I mean, come on, is our public health not worth getting a big giant centrifuge from Roche for every regional medical center and many in the city? I think it is. I think with all the money we spend on CDC and FDA conferences, that we really should have had these machines. And another thing I do believe is that CDC and the medical personnel here are just not, their whole personality, the design of the bureaucracy and the agencies, they're just not wired to move quickly. I'm not excusing them at all. I think that it is just absolutely abominable what happened, and I'll tell you what happened. Their guidelines still say that it would be impossible to test everyone. They still say that because of the sophistication and the expense and just the complexity involved in the definitive test of active cases. Sorry, I'm moving this around. So they still say that if you have an unknown, if you are a patient under investigation, you have like certain symptoms, then now they're allowing you to be tested. But before, it was if you have certain symptoms and you had contact with people from Asia or who had traveled to Asia, they still believed that. And so we had people with maybe flu-like symptoms or pneumonia-like symptoms going and asking for a test and being told no. This is unacceptable. This is just purely unacceptable. Furthermore, okay, listen to this. China put out the genome on January 10th. They published it on some website. In Berlin, several multi-European scientists created a protocol for that nasal pharyngeal swab test. And that protocol became the protocol for the World Health Organization. Basically, it's a standard whereby you create the test. Now, I had to sit there and slog through and read that. You could create a framework for the novel coronavirus without having the novel coronavirus genome even, just by using the SARS. If you thought maybe we were going to have a SARS-like outbreak, like it seems like Anthony Fauci thought we might have, and that's why he was doing that testing to make a new virus, and that's not allegedly, that's absolutely just, it's fact. If you were so concerned, then why wouldn't you have the framework of a test already? Because the SARS virus, the original SARS-1 virus, is 80% similar to the novel coronavirus. And literally in the Berlin protocol that I read, they said that they already created a test based on the SARS virus, and then when they got the genome from China for the novel coronavirus, they simply saw where the differences were and replaced whatever, protein chain or of the RNA was different. And so why could not the CDC have done that? Germany, Berlin, the group in Berlin came out with their protocol on, I believe, January 17th. The CDC came out with their protocol on February 3rd. And ironically, the testing around the world that WHO uses and CDC and all that is called a real-time polymerase chain reaction test, the one that goes into the machine. It's called real-time. Isn't that funny? Because if you're right near the machine, it can be done in 5 hours. But the CDC only authorized, they had very strict rules as far as like what labs could perform the test, number one. Why? Oh, my child's here. He wants to get in. Great. I might have to put this on pause for a second. Just hold on. So, right when we were getting into the nitty gritty, this is what happened. The regulations for who could run the tests, the sophisticated tests, the real time, were super strict, right? Then, the protocol that the CDC created was sent out on February 3rd, February 4th. Only about a day later, all of the certified labs that got it said that the results were coming out wrong. Now, how did they know that? Because, hold on a second. Yeah? Oh, okay. One second. The Cookie Monster needs something. You may not eat it while you're swimming or moving. You have to take a break and sit out in the sun. Apologies, apologies, apologies. Still there? Oh, hi, Garrett. Oh, okay. I'm finally synthesizing here all of the information I've been reading about the testing. So I'm getting to the absolute climax of it, and I get interrupted. So bear with me here. The CDC sent out their testing protocol, which is really their test kits, to the authorized labs. A couple days later, the authorized labs say that something's wrong. And how did they know something was wrong? Because by all accounts, they hadn't even tested anyone yet. Well, what you do is you run the test kit with sterile water. And they were getting positive results from the sterile water. Yeah. Very hard to find this information. I had to read through a bunch of stuff. And so they notified the CDC, and it took a month to get that corrected. Absolute travesty. I mean, I'm livid. Even though I do believe that, obviously New York is a hot spot and had logistical problems, and then also our nursing homes are a huge, infectious disease cesspools, really. And I'm sorry to say that. I mean, the lady that is advocating for patients who get medical associated infections, she calls nursing homes death pits. Anyway, while I believe all that, I really do believe that this whole crisis and death toll would have been way different if the CDC had not sent out contaminated test kits. Now, why were they contaminated, you ask? Many of the initial reports said that they were trying to screen for other viruses, and they got too ambitious, and I didn't see any evidence of that. The evidence that I saw was that in order to test for novel coronavirus, you actually have to have either you have to have a control with the actual virus or a synthetic version of that virus. Now, that's pretty common practice. The Berlin protocol actually had that. They had two choices. One was a synthetic novel coronavirus, and the other was the actual virus, and you have to actually get run it through an animal tissue. It's crazy. Like, it's completely new to me what goes into actually testing. And so whatever it was, when they were working with the synthetic control, it contaminated the kits. Sounds like a real rookie mistake to me. I mean, you can't use the excuse that the novel coronavirus, it was new. You can't use that because, like I said, the Berlin Protocol had the framework ready already with the 2003 coronavirus DNA or RNA, the genome. They had it ready to go, and then when they got the new one, they just like flipped out the wrong protein chain and put the right one in. And they didn't even know that the 2003 SARS virus was 80% similar until they got the genome and they ran it against it and they compared the two. Yeah. So when I first saw, and I actually saw it was Axios, and then the Washington Post, because they had to, because they knew it was out there already, said that there was synthetic coronavirus material being handled in the same lab, and that the practices were not up to standard at the CDC, and that's what got into it. I was thinking it was some sort of plot or, on purpose. But no, you need synthetic coronavirus in order, either that or something that has been injected into animal tissue. A lot of times they use, I was surprised actually. Is it a goat? Yeah, they'll use goats. Yeah, pretty crazy. Pretty crazy. But so I don't see it necessarily as a plot, but one thing I did find out is that the FDA sent a very respected researcher to the CDC on February 22nd. And the visit was actually arranged ahead of time. However, he arrived a day early and wanted to go in. Who knows why he arrived a day early, but he did, and they wouldn't let him in. So when he did finally get in, he discovered, his name is Timothy Stenzel, head of the FDA's Office of In Vitro Diagnostics and Radiological Health. He went there February 22nd to help troubleshoot the test kit defects. Now, Politico actually came out with an article, even though Politico has distributed much misinformation. They did talk about how there was a problem with lab test cleanliness, according to Timothy Stenzel, the FDA guy who went in to help them. And so I'm absolutely livid and bowled over. If you could see this sophisticated, slick brochure that the CDC produced for their wined and, for their elegant conference with receptions and everything in 2018 about emerging infectious diseases, you would be so angry. In fact, if I have it, I'll show it to you. But it is almost like a 9/11 thing where you go, really? The jet scrambling didn't work? Seriously, this is your one job? This is what you do? And you didn't get the jets scrambled fast enough to prevent the plane from supposedly crashing into the Pentagon? I mean, come on. So, I don't know. I don't know what to do. I'm baffled. I'm sick. I'm ill. And as far as Donald Trump goes, I mean, he puts people in place to deal with these things. Now, if you want to talk about the National Security Council's task force on pandemics, that is the National Security Council. Like, the cabinet has the Health and Human Services, under which goes, a whole host of agencies and things that also have their task forces and preparedness and readiness. And so a task force that meets with the National Security Council, which is already bloated, even by the Obama administration's admission, it was bloated. That is not the key task force. It's the CDC, Centers for Disease Control and Prevention. And the CDC did not control, they neither controlled nor prevented something that they knew could be a big problem. Trying to see that. What else do I have here? Okay. So that is looking into the past. Now I'd like to talk a little bit about, I mentioned the USNS Comfort and the Javits Center and how it doesn't make any sense that they closed those at the request of Andrew Cuomo. But then I already said, I think it was a logistical problem getting patients to those places. We know that they originally were going to take non-COVID patients, but they ended up being allowed to take COVID patients. And yet still the hospitals in New York continued to be overwhelmed. Really just so anticlimactic. Next topic is our favorite topic. Which is unproven treatments. And I just wanted to give a little follow-up on that. So I think you guys may have heard that remdesivir, which I've talked about since February, was finally given an emergency use authorization by the FDA last week. And Daniel O'Day, the CEO, was actually met with Trump in the Oval Office, and then I think he spoke in the East Room, but that wasn't even shared by very many news outlets at all. Of course, I was very happy to see that was approved by the FDA for emergency use, because they had had some promising results, initial results, even though they weren't completely randomized, double-blind controlled studies. They saw that at least, which was kind of a weird thing, that they were doing 5 days of the medication versus 10 days of the medication. But be that as it may, that's when Anthony Fauci decided to say it was a glimmer of hope, but not a cure by any stretch of the imagination, even though remdesivir was used on the very first patient to arrive in Seattle from Wuhan. You would think they would try to use it in New York the next day, but no, they didn't. He completely recovered. And why did I believe in it? I believed in it because it was shown to terminate coronavirus, novel coronavirus, COVID-19, in vitro. Pretty encouraging, right? And it was developed for Ebola. So that was approved. But very few people know that hydroxychloroquine, the generic drug that has been used for almost a century for malaria, was also given an emergency use authorization by the FDA on March 30th. How many people knew that? Well, I posted something about it, but honestly, because of all the bad press that had come out in the last 2 weeks with the VA study, people just get an impression, you know? They're like, oh God, okay, it's not popular to talk about this anymore because, well, that study really showed like it actually did more harm than good. And even when I've mentioned remdesivir on the Facebook page of Back to Facts, I've had, people who work in the healthcare field posting that that the Veterans Hospital had very poor results. And I have had to go back and find exactly what the deal was with that. So I am going to show you and tell you what was wrong with the Veterans Administration Hospital retrospective study of medical records of hydroxychloroquine administered to patients with COVID-19. Now, after the news came out, which was I think like 2 weeks ago Monday, a spokesman for the VA, Veterans Affairs, issued a statement by email saying this was not a clinical trial. It is simply an analysis of retrospective data regarding hospitalized patients. The findings should not be viewed as definitive because the analysis doesn't adjust for patients' clinical status and showed that hydroxychloroquine alone was provided to VA's sickest COVID-19 patients many times as a last resort. Oh, sounds like a really definitive study to me. And then we all are familiar with, those who follow Back to Facts, we are all familiar with Dr. Didier Raoult, who is the head of the Infectious Diseases Institute in Marseille, France. This is not a quack. This isn't even a flashy, flowery, controversial doctor. This guy has devoted his entire career to preventing infectious diseases. He had a whole building built by the last president of France. And yet the American media has maligned him and continue to malign him. He did a study with more than 1,000 patients, and almost all of them recovered. One died. And so the American media said that this VA study was the largest to date. It had like 380 total, but that includes a control group. And so they lied. They might say largest study to date in the United States, but that's because, again, like a circle jerk, they're preventing anything larger. Actually, I take that back. The Dr. Zelenko in Monroe, New York, did his own study with, I think he had treated 1,000 patients with incredible results. Most were not near death. And okay, so let's look at this. Dr. Raoult sent a statement out, and he said, in the current period, this was in response to the VA test. In the current period, it seems that passion dominates rigorous and balanced scientific analysis and may lead to scientific misconduct. And this article, VA Findings, is an absolutely spectacular example of this. The analysis of the data shows two major biases. Lymphopenia is twice as common in the HCQ groups as the non-HCQ group, and there is an absolute correlation between lymphopenia and fatality rate, which is well known. One of the major problems Raoul found was that the HCQ and the HCQ Z-Pack were given after the patients had been intubated, which means they got a ventilator. And we all know that when you get a ventilator, they give you propofol or something else so that you're sedated, because you're getting a tube down your into your lungs. And we all know that only 30% of patients make it out of intubation in general. So, quote from Dr. Raoul, "This is unreasonable at the time of the cytokine storm after patient is critically ill, as it is unlikely that HCQ alone would be able to control patients at this stage of the disease." The second problem, incomprehensibly, the untreated group actually received azithromycin in 30% of cases, without this group being analyzed in any distinct way. Azithromycin is also a proposed treatment for COVID-19 with in vitro efficacy. This, my friends, was the definitive study on hydroxychloroquine, which for many, many people closed the book on it. But now we did get a survey that somebody shared, it might have been Garen, showing that doctors, here I'll find it, that doctors view hydroxychloroquine as their go-to drug. That was 91% of the time. And let's see if I can find that. Largest analysis, oh no, that's the VA. That's the VA study. Largest analysis of hydroxychloroquine use finds no benefit for coronavirus, increased deaths. That was April 21st. That was in the Hill. I mean, that really closed the book for a lot of people. Okay, so let me see if I can find that. I don't see the one about 91% doctors using it, but I will try. I just want to say, though, that the FDA did issue an emergency use authorization for hydroxychloroquine on March 30th, and many doses were sent to New York, but I have heard, and it is my belief, that they have not been using it on patients. And as far as I know, I want to know what is going on in those hospitals. I've heard some bad things, and we've all heard some of the reports coming out by people who obviously have their jobs on the line, saying that using ventilators is the wrong thing, that these people are dying of hypoxia, which is a lack of oxygen, and that the virus actually attacks their hemoglobin, and the hemoglobin has a transmitter cell that normally carries oxygen to the rest of the body, but that the virus is attacking that. And I found a study about a week ago saying that hydroxychloroquine actually protects the hemoglobin, and oddly enough, the malaria parasite, guess what it feeds off of? It feeds off of hemoglobin. Now, I say this a lot, I'm not a scientist and I'm not a doctor or nurse, but I think it's pretty interesting that a drug that takes care of malaria right away, and malaria feeds off of hemoglobin, that drug would also, when it's shown in vitro to inhibit the novel coronavirus, that it wouldn't be given a very, very fast track chance. Now, the FDA did its job, but New York did not. And it's possible that from the bad press and the misguided press and the very unscientific reports on this drug, it's possible that hospital administrators refuse to administer that to their patients. We also know that both Dr. Zelenko in Monroe, New York, and Dr. Raoul, they've been using it in combination with zinc, and there's a reason for that. Oh, I missed all of your comments. I had to scroll down. Yeah, Garen, I know. I am so Okay, Garen says CDC, Center for Deep State Diseases Control. That's perfect. Okay, and then Mikovitz. Yeah, there are liars and thieves in our scientific community. Wow. Yeah, the VA study was totally bogus, Robert. So I'm just heartsick about it. I'm heartsick about the fact that many patients died after being or not being given hydroxychloroquine, that many health workers died at home. They could have been given hydroxychloroquine early on before being hospitalized. I think this is a crime, not to mention the crime of not being prepared with testing. Also, in addition to not being prepared with just prepared for a novel coronavirus that was only 30% different genetically than the one in 2003. And I also would say that, Singapore had really great outcomes, and so did Taiwan. And I looked into it a little bit. Like I said, they were able to trace contacts rather easily, even though they were using an antigen test. They could see who had it, but they could trace their contacts more easily because they had the antigen test right off the bat. Why we would not listen to Taiwan or Singapore or Hong Kong is a mystery to me. And so then I also saw in that slick brochure for the 2018 conference in Atlanta by the CDC, I saw that they even had a whole panel on school closures and mitigation of influenza B. In Hong Kong, they closed the schools, but it only had like a 4.2% reduction in overall incidence of infections. Now, this gets into the whole topic of herd immunity, but there was another panel, and so that was interesting. They were studying that. There was another panel about Taiwan. This I found very interesting. Improving medical preparedness for highly infectious diseases in Taiwan from 2015 to 2017. The Communicable Disease Control Medical Network has been established in Taiwan since the SARS outbreak in 2003 to receive patients with highly infectious diseases and further ensure surge capacity during epidemics. In 2014, the framework of the CDCMN had been readjusted from 22 responding hospitals and 17 supporting hospitals to 6 regional blah, blah, blah. Okay, so they did a lot of preparation, but they also are a small country geographically. So they basically just got it together with an actual plan. Yeah, how refreshing, an actual plan. But we knew about it because we studied it in this conference. Methods, strategy. Okay, they also said that the use of negative air flow was very important. And they also said that transmission in a healthcare setting is unbelievably high. So let me just see where I saw that. So if these people knew that having negative airflow, which means you don't let air escape, you just bring air in, because then otherwise if you let air escape through the ventilation system, it can infect other patients and healthcare workers. But so they changed their budget. They changed their budget in Taiwan to be used for the maintenance of negative pressure isolation rooms, negative pressure, and training program for healthcare workers. Wow, you think? Unbelievable. I'm going to pivot now to my final topic of the day. Yet another heartbreaking thing. I hinted at it when I was talking about the death pits. But believe it or not, the New York Times came out with an article not too long ago, April 17th, in fact, talking about nursing homes. And guess what little factoid they put down toward the bottom? Even before the pandemic, quote, 380,000 people die each year from infection at long-term care facilities, according to the Center for Disease Control and Prevention. 380,000 people die each year from infection at long-term care facilities, according to the Centers for Disease Control and Prevention. So you may think we're undercounting, or you may think we're overcounting COVID-19. You may think that we're undercounting COVID-19, like I saw articles. You know that the flu is actually just food estimate, they're over. They don't even really test. Uh, Obviously, clearly, we know very few testing capacity. It is assumed. Can you believe all viruses in the world that is assumed? And so, I don't know what you think. If you think that's exaggerated or not, or somebody, got a tractor and then died of it on the, those memes. But the fact 380,000 die each year from infection in long-term care facilities, aka nursing homes, is an absolute travesty. And like I've said in other videos, it's good to care about these people because they're our mothers and sisters and brothers and grandparents. But obviously, we didn't care about them that much before. Now, if we're going to sit here and talk about our mothers and grandparents and fathers and write story after anecdotal story in the New York Times about all of this, then I say we should have been writing the same exact level of stories in these same media outlets as we did for nursing home deaths from infection as we have for this. Do I think that COVID-19 is nothing? No. I think it was absolutely designed to designed to keep us flat-footed. And I am not just heartsick, not just heartbroken, not just nauseated. I am livid. I am livid. And who do I blame? I blame the Centers for Disease Control, which is a revolving door to the pharmaceutical companies. And I haven't even gotten into the vaccine situation, the quote vaccine situation, the myths and the facts. So, yeah, it's really, 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 really terrible. Yeah, no need to shut down. And all the media is doing is talking about a second wave coming in. And when the first wave could have been so much less, and I'll tell you the only reason it wasn't worse, the only reason it wasn't 200,000, 300,000 deaths already, is because Donald Trump closed our airports to people who had recently been in China and in Europe, because Europe got a lot of the flights from China. So, folks, this was an attack on our country. It could have been delivered by accident. Lack of preparation is this fact. Lack of preparation by the very people who trust to prevent infectious diseases is a passive attack on our nation. It's passive attack on those elected to protect us, because these are the that have been there since 1984. Anthony Fauci has been there since 1984. Deborah Birx is talking about how not everyone be sick. Yes, I think everyone else has an you should have gotten your butt off of your office chair and marched on down to purchasing and let them know that we need a road or a whatever huge machine in every single care facility in the country. So my time is up. My time is up. Please pray and for truth to come. That second wave is nothing. It doesn't have to be anything. We have the opportunity to redeem ourselves a little bit across the second wave. And I ask you to ask yourselves, as you on this information, which I am going to go, ask yourselves, why simple preventive measures haven't been laid out there in media? It's just these little pieces that make no sense when I said, why? Why are they focused on a second and acting like this? It's not solved. Why? I'm not sure, but thank you so much for joining me your valuable time. And about 2 minutes, I guess we're going to be on a time. Sadly, I don't think it's been informed of the but I did go his asked me political really in Charleston, and one quote he did say, did get really, really bad. And it's like, what's here? Do we realize that February 20th? Say it could get really bad. And he had the economy up, everything is amazing, and let's just see what happens. We got very long people and the government who got it. I'm not saying anything woo or crazy, but just think more information. Somebody blue and America.